Your nursing team would like to welcome you to Holmes Regional Medical Center and let you know what to expect while you're here. Please feel free to ask us if you have any questions, especially about any procedures. We truly believe that you and your family are an important part of your healthcare team, so we want and need your input. All staff members involved in your care will be wearing a Health First ID badge. They'll introduce themselves and explain what they're doing. They'll also verify your identity by asking questions such as your name and date of birth, and then comparing that with your wristband, the foundation of providing the safest patient care. Everyone caring for you should either wash their hands or use an alcohol hand gel before and after treating you. Proper hand hygiene is the #1 tool in fighting the spread of infection. That's why we also ask that you wash your hands frequently, either at the sink or with an alcohol towelette, especially after bathroom visits and before eating. As you become familiar with your room, be sure to locate the handheld nurse call button. Also, locate the bed controls on the side rails. For your safety, the bed should be in its lowest position and the railing lowered before you get out. And if you've been identified at risk for falling, as indicated by a special orange wristband, never get up without assistance from the nursing team. Please remind your family and friends that general visiting hours are from 11 a.m. to 8:30 p.m. each day. Because clinical care needs and patient privacy issues must be considered, we ask that you discuss after-hours visits with your nurse, along with requests for overnight stays or visits with an intensive care unit patient. Standard meal times are morning, noon, and early evening, and we do our best to accommodate food requests based on cultural needs. If you're not satisfied with your meal, please talk with your nurse. For those admitted between meal times, we keep limited snack items available based on your dietary restrictions and individual treatment and testing schedule. To make local calls using your room phone, simply dial 9 and then the 7-digit number. For long distance with a calling card, dial 9 and then the access number on the card. For all other calls, dial 0 for the hospital operator's assistance. You're watching this video on My Care Connection, your comprehensive entertainment and patient education system. Here, you can easily watch TV, purchase an unlimited daily movie pass, or find hospital information and access dozens of educational videos related to your care. There's even a survey so you can give us feedback. Plus, internet access through a wireless keyboard. With the same handheld controller used to call the nurse, push the arrow keys and green OK button to navigate through the menu system and select your choices. And a special info button on the lower left will always take you back to information on how to operate My Care Connection. You can always ask a nurse for assistance or push the main menu button. We do our best to make your stay here as restful as possible. Sometimes, hospital capacity issues may require changes in your room assignment. And of course, the hospital is a 24-hour-a-day operation with some level of noise around the clock. Patients often wonder why they may be woken up during the night to have blood drawn or for other testing. Your lab work must often be timed for optimum results or to help the physician plan your treatment options. We apologize for any inconvenience and appreciate your cooperation. Because of our focus on patient-centered care, we believe that every patient has the right to effective pain management. Your nurse will ask you to rate your pain on a regular basis so we can work with your physician to make you as comfortable as possible. Your nursing team will keep you informed about your daily treatment plan. Before you're discharged, you may also interact with a case manager who helps coordinate any services you might need once you're released from the hospital. We encourage you to speak up about any concerns by talking with your nurse, the unit charge nurse, or the nurse manager. And if you'd like, you can request to talk with a patient advocate. This number is listed in your patient guide and under the Patient and Visitor Guide Special Services link on My Care Connection. We want to positively change the health and well-being of you and your family through excellent and compassionate health care that takes into account your medical, emotional, and spiritual needs. On behalf of your entire clinical care team, thanks for watching.